6 people. Okay. When you walk into a doctor's office, whether it's being to be seen for a well check or even just because you're sick, you have people that start taking you from the moment that you walk in the door, from checking in for your appointment to getting vitals checked or even to being seen by the nurse practitioner, physician's assistant, or doctor. While you're in the office, besides the provider, of course, do you ever just assume that they're just a receptionist or a nurse? Most people do when it comes to medical offices. With that being said, there are so many different people that can be in the office of a medical practice, and they all can do very similar things or nothing at all that the other can do. I deal with this every day in my current employment as a certified medical assistant. What is that, you ask? Well, I will tell you all of the main things that medical assistants do in their daily jobs and the differences we have with nurses and other medical personnel. First, I'm going to start with the history of medical assistants. In 1955, the AAMA was formed. The first official exam held in Florida, Kansas, and California, and less than 50 years for medical assistants to have a governing body to produce graduates eligible for national certificates. My relevance with medical assisting, well, I am currently a medical assistant. I've been one for 5 years, and I worked with Carl for those 5 years. I started school in 2018 and graduated in 2019 and got my official CMA job in June of 2019, and I've been there since. Every day I go over the hurdles of what's a medical assistant, what do you do, what's the difference between a CMA and a CNA, all the different questions. Now that I have covered some history of medical assisting and why it is relevant for me, let's talk about some medical assistant stereotypes. One of the biggest stereotypes is that MAs are the same as NAs, or CMAs are the same as CNAs. A medical assistant can collect or prepare or transfer specimen, do routine lab testing, prepare patients for procedures, check and record vital signs, which is something similar that CNAs can do, administer medications under a physician's supervision, phlebotomy, and EKGs. CNAs, or certified nursing assistants, assist with daily activities of life, reporting changes in conditions of residents, provide companionship, and they move and transport patients. They can also do the vital signs and such. CNAs cannot perform any open wound care, insert any catheters, or administer any medications. MAs are always described as similar to nurses as well. Although we can do some of the things that nurses can do, there is a whole list of things that we are not able to do as medical assistants, and vice versa. So MAs not only can do the clinical side of things, but they can do also administrative tasks such as office correspondence, billing, maintaining the file records, checking in patients, stuff like that. Nurses, on the other hand, according to Dr. Zhang, a nurse completes all nursing care processes such as medication administration and patient education, in addition to overseeing basic care duties. Nurses more so do all the hands-on things that CMAs cannot do without a physician, nurse practitioner, etc. being present. Over the last 5 years of being a CMA, I have these questions every day of what we do, who are we, and so on. But I've also had a lot of lessons along the way. One of the biggest life lessons I've learned as being a CMA is empathy. Understanding and sharing feelings of patients and what they're going through on a daily basis, whether they come in to be sick or seen because they're sick or injured or whatever the case may be. You just have to put yourself in their shoes and understand what they are going through in that moment. Being able to validate everybody's emotions that walks through the door. Some people are upset because they went to another clinic and didn't have a very good experience, so then they come in angry to us, and you just have to understand why they are feeling the way they are feeling and try to make it a better experience for them. Cultural competence, engaging with patients with different backgrounds and beliefs. We do have quite a few patients that come in and they have different beliefs. They're from all kinds of different cultures, understanding different perspectives of everyone. You just have to be understanding with everyone that walks through the door. The next time you walk into a doctor's office, you may or may not be more aware of the staff that you're talking to. Some are receptionists, some are CMAs, some are nurses, or even CNAs. Depending on the setting that you're in, being a CMA has taught me a lot of lessons, helped me mature more, and overall has just made me a better person.